Okay. Okay, so this is Amelia. I am doing my check-off for nasogastric placement and removal. This is my patient, Mr. Chamberlain. I have an order to place an NG tube. Place NG tube from Dr. Feelgood for decompression times 24 hours. After 24 hours, says bowel sounds. Remove NG tube if bowel function is normal and at baseline. Okay, and I have gathered my supplies here. You can see that. I'm sorry if you hear my cat is running around. The crazy person. Okay, those are my supplies. The first thing I'm going to do is I'm going to assess the patient's history. Assess the patient's history. Threw me off. And I'm going to check for history of aspiration, nasal polyps, nasal bleeding, anticoag therapy, chronic sinus infections, and surgery to the oral, facial, or sinus in surgeries. Next, I'm going to take my clean supplies that I have on a tray, and I'm going to go to the patient's room. Hey, Mr. Chamberlain, my name is Amelia. Dr. Feelgood wants me to put in an NG tube to help with some decompression of your bowel. Can I get your name and your date of birth? Give us his name and his date of birth. And I'm going to go ahead and perform hand hygiene. I'm going to provide privacy. I will pull the curtain. I'm going to raise the bed to hip height. And before I even touch her, I'm still talking to the patient. I'm going to ask the patient the reason for this procedure is to help with decompression of his bowels because he's been having some hyperemesis. And I'll ask the patient, does he have any questions? And he said no. And then I would get consent to actually place the tubing from the patient. Next, I would let the patient know after 24 hours if his bowels are better, we would remove it. And then I would tell him that it's not a pleasant procedure, it is uncomfortable, and it could obviously cause some gag issues while being inserted. And the patient still said he's fine with that. I'm going to assess him for pain, nausea, and vomiting. Next, I am going to get a pen light. I'm going to look in the patient's nose. I'm looking for any nasal polyps, bleeding, irritation to the mucosa, any obstructions, and a deviated septum. I'm going to ask the patient if he has a recent history of nosebleeds, nasal trauma, or any nasal surgery, and he said no. Next, I will assess the gag reflux with a wooden Q-tip. I'm going to check gag reflux is present. Get off my tray. And let me back up. Before I touch the patient, I would do hand hygiene. I'm going to put on my gloves. Then I would assess for obstruction, nasal bleeding, nasal polyps, irritation to the mucosa, deviated septum. I would also want to check for patency of the nares. So I would hold one side, have the patient take a deep breath in and out through the unoccluded side, and do the same thing for the left side. So the right side seems to have more air moving through it better. I will assess for gag reflux with my wooden cotton tip. You doing okay, Mr. Chamberlain? He says yes. I am going to open my tape, and I'm going to tear off 2 pieces of tape. One tape is going to be just a regular regular piece of tape. Can I stick this to your bedside table? And he said yes. And this is going to be for my anchoring. Just tore that for anchoring. So I have my tape. I am going to open up my NG2 packaging. Check my tubing. It's in place. I have this piece is put into place. I'm going to sit that there. Before I cover the patient, I'm going to also auscultate the patient's. I'm going to auscultate the lungs and the bowels, all four quadrants. And his bowels are hypoactive. Lung cells are clear. After I do that, I'm going to go ahead and get a towel over my client. I'm going to give him an emesis basin. And I'm going to give him a cup. Well, let's hold off on that. I'm going to take my NG tube and now I'm going to measure. I'm going to measure from the tip of his nose to his earlobe to his xiphoid process. I measure from the tip of his nose to his earlobe to his xiphoid process, which is right there. And that has me going down to 35. And I would mark this with a Sharpie or a piece of tape, but I do have numbers on here, so I know I'm going down to a 35. And at this point, I'm going to wrap this tubing, trying to get it a little tight. I'm going to attach a 60 ml syringe to catch any gastric contact. I have my lubricant. I'm going to put my lubricant down. So I'm just getting my tubing. And while I'm kind of doing all this, I'm going to give my patient a cup of water with a straw. And then I'm going to let him know as I advance this down, I'll have him take sips of water. So I have my tubing. And I'm going to curve it so it'll go in. So that's a little bit better. So I'm going to lubricate. My patient's in high Fowlers. I'm going to have them hold their head back as far as it'll hold their hair back. And I'm going to go in. I'm going to lubricate the first 4 inches. I'm going to take the lubricated end. And I'm going to insert going back towards the sinuses. And once I'm in those first 4 inches or so, I'm going to stop and give the patient a chance to catch their breath. Tell them, ask them if they're okay. Because this is going to be the point where it's going to be the most uncomfortable, but we're going to get over the hump. So I'm going to have the patient tuck their chin and start taking sips of water. And as they continue to take sips of water, with each sip of water, I'm going to advance. So they will be sip, advance, sip, advance, sip, advance, sip, advance. Okay. And I've gotten to the 35. I'm going to hold on to the tubing here because it is in his nose. I'm getting some greenish bowel content back. I'm going to anchor. Oh gosh. Try to anchor the tubing as best I can. And then anchor across this way. I can take a cup away, and I'm going to secure it to the patient's gown with a clip. Maybe. So it is secured. My tubing is in the belt. I'm getting some content back. So I'm going to draw off 10 mLs of my gastric content. And with this content, I would test the pH. I will also get an x-ray done if we're going to be using this for any medication or feeding. Once I've confirmed that this gastric content is normal, I will replace it back. And then I would clamp this tubing off. So the patient is secure. And also I would want to also take the lungs and check the patient's SpO2 levels, make sure their oxygen is normal. And I would take my gloves off, clean up my supplies, and perform hand hygiene. Now I wouldn't have gloves on initially to start this next part, but I don't want to take these off and have to put them back on because they're hard to get back on. But I've confirmed that the patient's bowels have decompressed. Bowel sounds are hyperactive now, so I do already have my order to take out the NG tube. So the first thing I'm going to do is I'm going to hold the tubing and I'm going to remove my tape from the patient, and I'm going to remove the fasten that is fastened to the gown. I'm going to have the patient take a deep breath in, hold their breath, and I'm going to pull the tubing out. I've pulled the tubing out. I'm going to assess the tubing. The tubing is intact. I am going to document my findings to the provider. I'm going to assess the patient's comfort at this point and pain. He said he feels so much better. I'm going to lower the bed, lock the bed, pull the side rails up as needed, call light within reach. That's it. I'm going to document my findings. I'm going to take my gloves off, and I'm going to perform hand hygiene.